Good evening. Welcome to our Halton District School Board Reopening Schools Information Session. Thank you for joining us. My name is Rob Etoff, and I'm one of the superintendents here at the Halton Board. I'll be helping to moderate our discussion over the next couple of hours. And for those who are not able to attend tonight, no worries. We're recording this session and we'll be posting it on our website tomorrow. But before we begin, I'd like to share our Halton District School Board land acknowledgement. Halton, as we know it today, is rich in history and modern traditions of many First Nations and the Métis. From the Anishinaabe to the Attawandaron, the Haudenosaunee, and the Métis, these lands surrounding the Great Lakes are steeped in Indigenous history. As we gather today on these treaty lands, we have the responsibility to honor and respect the four directions: land, waters, plants, animals, ancestors that walk before us, and all the wonderful elements of creation that exist. We would like to acknowledge and thank the Mississaugas of the Credit First Nation for sharing their traditional territory with us. The purpose of tonight is to provide you with additional information to help complement what we've already been sharing through our social media, through our information and emails to parents, as well, of course, as our broader reopening schools plan that's been posted on our website. Over the past 48 hours, we've received in excess of 2,600 questions, and we have certainly reviewed each and every one of those, and we know that they're continuing to come in as we speak. We will continue to monitor them. We obviously won't be able to address all of them tonight, but have tried to select those that are more applicable across the board versus those that may be more school-specific in nature. The format of the evening will be to address some of your health-type questions up front, and then move to questions that are more applicable to those in our elementary schools, followed by our secondary schools. Joining us on our panel this evening are Dr. Meghani, Commissioner and Medical Officer of Health for Halton Region, Andrea Gerbens, Chair of the Board, Stuart Miller, Director of Education, and a team of superintendents who've been involved in the development of our reopening schools plan. At this point, I'd like to call upon Chair Gerbens, followed by Director Miller, to help set some context for us and share some introductory comments.
I'd like to welcome parents, staff, students, and community members tonight. This is an opportunity to get some more of your questions answered, and I know that there are lots out there. We have a very engaged community, and it's great to see all those questions come in, and we will do our best to try to answer them. We really appreciate Dr. Meghani coming tonight to help us with our evening. And I want to let the community know that the trustees of the Halton District School Board support their staff in the plans that they have made and the implementation to get students back into their learning environments this year. Staff have been working on these plans since the spring. And I also want to say that our staff are professionals. They've worked very hard on these plans and protocols. Staff at the board office and in our schools are dedicated professionals. They have devoted their lives to student achievement and well-being, and they are all doing their best, their utmost, to make sure that your child is safe or that your work environment is safe. So on that, I will hand this back to Rob. Or actually, I'll hand this over to Director Miller.
Thank you, Chair Gerbens. And I too want to welcome you all to the town hall this evening. And thank you for joining us. And thank you for the many, many questions that you have sent to us. We appreciate that this is a very anxious time for so many, for students, staff, and parents, and the broader community. And we know that many things that we say or questions we can answer may not alleviate your anxieties. What we're trying to do, though, is mitigate as many as we possibly can. As you are fully aware, this is a very fluid situation. Science is, I wouldn't say science is changing every day, but there's new science emerging every day, new reports, new assessments emerging all the time, and sometimes new directions from the ministry. For example, just today, the ministry announced a change in some of the health and safety protocols. We now have to take a look at that to see how that fits in with what we were doing based on the old protocols. And the federal government announced additional funding. We don't know how that rolls out, how much it is, what that means, but we'll have to look at that in the next few days. And as you know, just a couple of weeks ago, on August 13th, there was a change in some of the protocols around the models of teaching that we needed to do. So we had to go back, reset, and we had to delay our intent to return and then come back out with a new intent to return. And finally, we have ordered hundreds of thousands of PPE, which we have not yet received. We have been told that we will receive them prior to school, but of course, as you can appreciate, there's a lot of organization to distribute hundreds of thousands of PPE to 105 schools and thousands of staff members and students. So again, I thank you and I welcome you. As a result of these conversations, and Rob has already said we won't get to all the questions tonight, I'm going to announce a couple of things that communication will follow. The details will follow to all parents, all teachers, all staff tomorrow, likely, we hope. But again, we're still working on the details. As the challenge around organizing our schools is immense. As I said in an email some time ago, we start staffing our schools in March. We have now got about a week to do the same job that takes us 4 or 5 months. So with that, I can tell you that we will be delaying the commencement of school. We are targeting a date for September 14th, which is the Monday after the first official week of school. We are hopeful and intending on bringing small groups of students in their cohorts the week prior to the 14th, so that we can go over some health protocols and work with them. And for our special needs students, we will be contacting those parents directly, because those students we will be getting into school earlier so that they can learn and understand what they have to do for many of our students with the greatest needs. In addition, as you know, and Dr. Meghani will speak about this evening, masking has been a significant issue. There's been immense pressure brought to bear on the board, as many boards are requiring masks from JK to grade 12. We have not done that, but we are making masking mandatory. We are changing hours, and Dr. Meghani and Superintendent Ruddock can explain, well, particularly Superintendent Ruddock can explain why, from grades 1 through 12. Will be mandatory. Kindergartens will not be mandatory, although we will still recommend it. So having said all that, I would now like to introduce Dr. Meghani. She's the Commissioner and Medical Officer of Health, Halton Region. Dr. Meghani is the Commissioner and Medical Officer of Health for Halton Region. She is a public and preventative medicine physician and a fellow with the Royal College of Physicians and Surgeons. Dr. Meghani has a Master's of Public Health in Family and Reproductive Health and a Master's in Management Health Leadership. She joined Halton Region from the City of Hamilton in 2014. Dr. Meghani is passionate about public health, prevention of illness, and increasing health equity. As a mother and Halton's Medical Officer of Health, she is deeply committed to keeping children safe and working with partners to create an environment that fosters good health. It has been our privilege and to have a relationship and a continuing ongoing relationship with Dr. Meghani and her staff, and they have provided us with timely and cogent advice that will help your children be safe in our schools. So with that, I will turn it over to Dr. Meghani.
Thank you so much, Director Miller, for that very kind introduction. And thank you all for being with us this evening. It's a very rainy evening out there, and so thank you all for spending the time. So just want to make sure that the slides are up. Great. So today we're going to talk about a safe and healthy return to school. Heading back to the classroom has always come with mixed emotions. We regret the passing of the summer, but look forward to the resumption of school year routines. This year, our routines will look very different. And because of COVID-19, many of you that are tuning in, teachers, parents, and students, are likely feeling more anxious than usual. So let me say up front that public health is here for you, and we are working together with the Halton District School Board to support our schools as they prepare to reopen. We've been working together with the board at every step of the way throughout this planning process and are confident that we will be able to provide a safe and productive learning environment for students and staff. So perhaps we could go to the next slide. I understand very well that this is a difficult time. Students have been out of school since March. As parents, it seems like you're facing an impossible choice. Do you pursue remote education for your child? This option makes it more challenging for children to socialize with their peers, and you may be working from home, which in itself adds complications. I know. Do you opt to have your child return to school buildings at a time when there is talk of a second wave of COVID-19? Unfortunately, there is no right choice, only a choice that works best for you and your family. So let's be clear. To reach their full potential, our children need the learning and socializing that in-school education provides. Next slide. Attending class is good for their education, good for their well-being, and good for the whole family. After months of isolation, where possible, our children need to be with their friends. They need to be able to play, learn, and socialize in as safe an environment as possible. That said, as we open up more opportunities for people to gather in the community in places such as schools, we will certainly see more cases of COVID-19. It is simply not possible to prevent all cases. What we can do is work together to try to contain outbreaks and minimize the most severe outcomes. Next slide. So everyone's situation is different, and the decision to send your kids to school in person needs to be one that works for you and your family. You need to think about your child's specific needs, and you need to think about the people who live with you and your child, as well as the level of spread in your community. Let's start with your child's needs. Does your child have special learning needs that require in-class supports? Or does your child have any medical conditions that may make them prone to severe disease if they get COVID-19? Kids who have underlying medical conditions, such as lung diseases like cystic fibrosis, cancer that may reduce their immune system, or diabetes that is not well controlled, may be more at risk. Talk with your child's doctor to discuss the risks. In some cases, staying home may be the safer option, but for most kids, the benefits of being in school will outweigh the risks. While we're still learning a lot about COVID-19, what we do know so far is that most children infected with the virus experience mild symptoms. Common symptoms of COVID-19 among children include fever, cough, runny nose, sore throat, headache, body ache, and diarrhea, and many children may have mild or no symptoms. Additionally, children account for a small number of COVID-19 cases overall. Next slide. By August 23rd, 6% of all confirmed COVID-19 cases in Ontario to date were aged 0 to 19. compared to 21% of the population falling into this age category. Severe outcomes, including things like hospitalization, ICU admissions, deaths, and complications, have been rarer among cases in children compared to adult cases. I'd also like to point out that as of August 23rd, only one of the 2,798 deaths reported to date for Ontarians were amongst cases aged 0 to 19. Further to that, we've had lots of experience with childcare centers, which have continued to operate throughout the pandemic, and we have not seen an increase in COVID-19 infections in these settings. Next slide. So similarly, by August 23rd, there had been 60 confirmed COVID-19 cases in Halton who were aged 0 to 19, accounting for about 7% of Halton's cases, whereas children 0 to 19 are estimated to make up 24% of the Halton population. If probable cases are included, the proportion of Halton cases aged 0 to 19 rises to 10%. However, this is still lower than the population's proportion. There have been no deaths among COVID-19 cases aged 0 to 19 here in Halton. So next, let's think about the people with whom you live. Most people with COVID-19 infection will develop mild symptoms and will recover on their own at home. However, the risk of severe illness and outcomes is higher for those who are above the age of 70, or those who have chronic diseases like diabetes, high blood pressure, heart disease, or cancer. If you or a family member are medically fragile, you will again need to weigh the benefits and risks. And here again, you can consult with your healthcare provider to help you make an informed decision. There are ways to lower the risk, such as keeping sick children away from the at-risk person in your home and making sure that they are not exposed to other social networks that could expose them to the disease. I should also add that overall, the evidence to date suggests that children are not significant transmitters of COVID-19. But here again, as Stuart mentioned, we are still learning a lot about this disease. Next slide. The bottom line is that decisions around heading back to school will be different for every family, depending on your child's academic needs, whether your child or household members are at increased risk of severe illness, and your family's unique situation. You need to also consider the level of community spread in our area. The most frequently reported way that children in Ontario have been infected has been through close contact with another person who has a confirmed case of COVID-19. Next slide, please. So for our part in public health, we provide guidance in line with the provincial plan around implementing appropriate infection prevention and control measures, and have posted guidance documents on our website. As I mentioned earlier, we're working with the school board to ensure that important measures are in place to protect our students and staff, including active daily screening, no mixing of cohorts or classes in the elementary years except in specific situations, ensuring children understand how to properly wear face coverings or masks, and enhanced hand hygiene and cleaning. Staff at the schools will also wear personal protective equipment, such as masks and eye protection. Please note that public health does not provide this equipment. It will be provided by the Ministry of Education. Next slide, please. Additionally, we provide support with the development of safe school reopening plans. We don't approve the plans, we simply provide guidance which we have to the Halton District School Board. This includes providing recommendations and resources to help school boards and private schools develop policies and procedures to ensure the health and safety of staff, students, parents, guardians, and visitors. Supporting training and educational opportunities for school staff regarding infection prevention and control practices, developing processes and protocols for managing sick students and staff at school, developing guidance around managing a confirmed case and an outbreak at the school, ensuring schools have child-friendly resources that support healthy behaviors in the school setting. Next slide, please. So you may recall that earlier this summer, the provincial government announced that it will spend $50 million to fund 500 additional school nurses to provide rapid response support to school boards and to schools and boards in facilitating preventive measures, including screening, testing, tracing, and mitigation strategies. In Halton, we're waiting to receive terms and conditions on this new funding. In the meantime, we've already dedicated many resources towards supporting school reopenings, and we will continue to increase our public health nurse staffing in the coming weeks to provide more support as schools begin to reopen. Next slide, please. It's expected that school health nurses will support the safe reopening of schools, including supporting existing school health and communicable disease control programs. Our nurses are already involved in the development and implementation of COVID-19 health and safety plans. We've also provided information on infection prevention and control, what we call IPAC, to our school administrators. By mid-fall, we plan to begin infection prevention control support visits with schools. Our epidemiologists at Halton Region Public Health are planning to do surveillance of absenteeism specific to COVID-19. Screening of students will also be done by parents at home, with some active screening that could happen at the school. Through the first wave of COVID-19, our nurses have become experts in case and contact management of COVID-19, as well as outbreak management. We have worked with long-term care homes, retirement homes, and many other congregate settings and childcare centers that have been operational. We've prevented many outbreaks by helping these settings put many measures into place before a single case of COVID-19 was detected or after a single case to prevent further transmission. Using this expertise and the guidance from the Ministry of Health, we will do the same for schools. Both myself and our Associate Medical Officer of Health, Dr. Deepika Lobo, are always involved in outbreak management and provide guidance and direction to our public health nurses and school staff. Our nurses will also support things like communication and engagement with parents and local communities, as well as primary care through our COVID-19 call center, which is accessible during business hours and may be available after hours should there be a second wave or surge. Some of you may be familiar with this call center, as I'm sure that there were some of you who may have used it to try and understand more about COVID-19. I want to take a moment now to discuss testing for COVID-19, as this can be a very confusing topic. Testing in Halton is not done through public health. However, should there be a case or outbreak of COVID-19 in a school setting, public health will make decisions about who needs to get tested and communicate this to affected families and staff. Testing is available in Halton through hospital-based assessment centers. Contact information for these assessment centers is available on halton.ca/COVID-19. And going to an assessment center does require a booked appointment. All symptomatic individuals and contacts are seen either same day or within 24 hours. Some primary care physicians are also offering testing for their patients in their offices. One more note about testing. You and your child do not need to go get tested prior to the school year commencing, unless, of course, you have symptoms of COVID-19 or have been informed that you are a close contact of a confirmed case of COVID-19. There may have been some mixed messaging on the subject in other parts of the province. I want to assure you that here in Halton, this is not required. Next slide, please. While Halton continues to have a low number of cases, returning safely to school is a community effort, and we all have a role to play to help keep our numbers low. This means we're counting on you to tighten up social circles as much as possible, practice physical distancing, follow good hand hygiene and respiratory etiquette, wear face coverings in indoor public places and when physical distancing cannot be maintained, get tested if you have one or more symptoms of COVID-19, and of course, stay home when ill, even if you have very mild symptoms. Otherwise, this is how COVID-19 spreads in our community. Next slide, please. So along with these steps, knowing what to do if you've been exposed to COVID-19 is another key way to protect yourself and your community. One way to know if you've been exposed and the steps you need to take is to download the federal government's free COVID Alert app from the Google or Apple Store. The app does not collect, store, or access any personal data or health information and is completely voluntary. You can choose to download, use, or delete it. But the more people who use it, the more effective it will be in helping to protect each other and our communities. Next slide, please. One of the best pieces of advice I can offer you today is to stay informed about both your school's plans and current public health advice. If your children will be learning remotely, talk to them about how the school year will be different and look for opportunities for them to socialize and be physically active. If your children will be going back to the classroom, talk to them about the importance of keeping themselves, their classmates, their teachers, and school staff safe. In either case, encourage them to talk to you about their concerns and ask any questions they may have. Next slide, please. Here are a few tips that you can consider. Firstly, remind your children how to properly wash their hands and give them hand sanitizer. You can also remind your children how important it is that they not touch their face or their friend's face, especially for our very young children. Explain to your younger children that they should not put objects into their mouths. Remind children about the importance of not sharing food or personal items, such as toys, and for older children, their cell phones. Next slide, please. Explain to them what physical distancing really means. So for instance, for younger children, you could encourage them to spread their wings when standing in line with one arm in front and one arm behind to keep 2 meters between everyone. You can also encourage children to greet each other using non-physical gestures. For example, a wave, a nod, or a verbal hello. With younger children, you can also practice following directional signs. Visit a place where there is directional signage already, such as the mall, and point the signage out to them. Or use chalk drawings on your driveway to show what floor decals may look like. Try to make sure that your children are up to date with all their recommended vaccines, including the vaccine for influenza when it is available later this fall. Next slide, please. School boards must follow minimum requirements set by the Ministry of Education related to masks and face coverings, but each board also has decision-making authority to exceed these minimum provincial requirements. What will be especially important will be to ensure that children understand how to wear masks properly. They need to wear masks that fit well around their nose, mouth, and chin without gaps at the sides. Clean their hands before putting on, taking off, or adjusting their masks. Avoid touching their masks while wearing them so that they don't contaminate their hands. Wearing a mask correctly for a full school day may be particularly difficult for younger children and children with underlying medical, developmental, and mental health conditions. It will be very important for schools to plan for what we call mask breaks, with appropriate physical distancing, of course, during the school day. And this will help children learn and practice with their masks. You also will need to learn and practice regular hand washing and good mask behaviors. We will be supporting all schools by developing age-appropriate mask education for our students. You can refer to the video linked on the slide for more information. Next slide, please. And finally, encourage children to ask questions, express concerns, and remind them how important it is to be kind to each other once they are back in the classroom. For students of all ages, it will be important to support not only their physical health, but also their mental health. Next slide, please. As I said up front, it will not be possible to prevent all cases of COVID-19, but we need to work together to try to prevent and contain outbreaks. Further guidance from the Ministry of Health was released this afternoon to public health units and school administrators related to processes for dealing with a positive case in a school. And we will provide updates to our school community once we have had a chance to review this guidance in more detail. For now, in the event that a student develops signs or symptoms of COVID-19 at school, our guidance advises that staff member immediately separate the student from others. A staff member should then supervise the student in a designated room or space, which they should disinfect once the student leaves. The student's parent or guardian should be contacted to pick the student up immediately. Next slide, please. Students with symptoms and their siblings must be picked up and taken home. Students with symptoms must self-isolate at home and be referred for testing. Household members, including siblings, must also self-isolate at home. To return to school, they will need to self-isolate for 14 days or be medically assessed and cleared by a physician to return to school or show negative test results. If test results are negative, the student may return to school after being symptom-free for 24 hours. If a student or staff member tests positive for COVID-19, Halton Region Public Health will notify the individual and school and provide further information on contact tracing and outbreak management, and we will endeavor to maintain confidentiality. Anyone who is confirmed positive must have clearance from public health in order to return to school. Next slide, please. Generally, an outbreak means that there are at least 2 confirmed cases in a particular setting that are linked somehow. Based on our initial assessment, should there be 2 cases in a school, public health may declare an outbreak. If an outbreak is declared at a school, public health will investigate to see whether others at the school are impacted. We will define the outbreak area and identify any others who will need to be contacted and tested. We will send the school an outbreak declaration letter and continue daily contact with the school until the outbreak is closed. Schools are responsible for keeping staff, students, and families informed. As I mentioned before, we will also provide guidance and direction on who needs to get tested or should be considered for testing. We will also provide direction on who needs to be self-isolated versus who can continue attending school. Monitoring for signs and symptoms of COVID-19 will always be required by all families and staff. regardless of whether a case of COVID-19 has been identified at school. Next slide, please. So in conclusion, there is no risk-free option, unfortunately. Sending your child to school may increase the risk of getting COVID-19. On the other hand, keeping your children at home may increase the risk of interrupting their social, emotional, and developmental well-being. As I said up front, there is no right decision, only what is right for you, your child, and your family right now. We all need to continue to work together to help our children learn safely. By vigilantly following public health measures, staying informed, and keeping your children home when they are ill, you will be helping to limit the spread of COVID-19 in schools. Halton Region Public Health offers resources for all parents, including mental health resources and guidance from additional organizations such as the Hospital for Sick Children. It's all on our website at halton.ca/COVID-19. And you can subscribe to Halton Parents' social media channels for more information at halton.ca/haltonparents. Next slide. So I hope I have answered the majority of your questions with this presentation, but now we'll take a few minutes to respond to a few more questions. Thank you all.
Thank you so much, Dr. Meghani, for that very comprehensive presentation. I know we have many parents online, and that information that you shared certainly resonates with many of the emails that we've been getting and correspondence from families around questions and areas of concern, and sometimes just areas of clarification. So we very much appreciate you walking us all through that critical information as we navigate our reopening process. We do have a few questions here, if you don't mind. I'd like to start. The first question is, if a child is experiencing just one symptom, are they required to stay home?
So the short answer is yes, but I'll give you a bit of a long-winded answer. The Ministry of Education does require that all staff and students, with the support of their parents, self-screen every day before attending school. If a student or staff member is experiencing any one symptom of COVID-19, for example, runny nose or sore throat, they must stay home from school and should seek medical assessment. A first step can be to use the Ontario Self-Assessment Tool or call telehealth. However, I think that there will be some more information coming out to parents shortly. If their symptom is related to an underlying reason, such as, for instance, seasonal allergies, then the staff member or student will need to follow school board processes to confirm this. It is important for these individuals to continue to monitor their recurring symptoms and to seek medical assessment should new or worsening symptoms occur. And I want to highlight that this is the same as the requirements that we currently have for children attending childcare, as outlined in our Halton Public Health Guidelines for childcare settings.
Thank you very much. We do have another question here. It's also related to the area of symptoms. What should teachers and other school staff do if they see a child at school with symptoms?
That's a great question, and I started to allude to that in my presentation. So staff, of course, are to monitor themselves and students for signs and symptoms of COVID-19 during operating hours. Staff will be provided with information on the signs and symptoms of COVID-19 in children before the start of the school year. And students are encouraged to alert their teacher as soon as they do not feel well. A student with signs or symptoms of COVID-19 should be immediately separated from others and supervised in a designated room or space at the school. Their parent or guardian will then be contacted to pick them up immediately. The student should not take school or public transit. School protocol should include procedures for picking up students with signs and symptoms of COVID-19, including their household siblings. The student should seek medical assessment promptly. Any staff or essential visitors with signs or symptoms of COVID-19 must go home immediately. If they cannot return home immediately, They must be isolated in that designated room or space until their departure. Any staff or essential visitors with signs or symptoms of COVID-19 should avoid using public transportation as well. A kit will be made available for use by the ill individual and staff member attending to them. The kit will contain things like alcohol-based hand rub, gloves, medical masks, eye protection, and a gown. Instructions on proper use of personal protective equipment will be available on the outside of that kit. A non-contact thermometer should also be available, and a temperature check is recommended if the ill individual complains of fever. The thermometer must be covered with a single-use protective cover, discarded after each use, or cleaned and disinfected after each use. Staff and children who were exposed to the ill individual must continue to be grouped together and monitored for some symptoms of illness until the ill student receives their test result. If an individual tests positive for COVID-19, Halton Region Public Health will notify the individual and the school administration and will work together with the school to identify close contacts and inform parents.
Thank you very much, Dr. Meghani. One of the questions that has just come in is with respect to schools being required to take the temperature of students before they enter the premises. Could you please respond to that?
Absolutely. And a very good question, as we start to see a lot of places taking temperatures, even workplaces. So the Ministry of Education requires all staff and students with the support of parents to self-screen prior to attending school, as I mentioned before. On-site temperature taking is not required, and furthermore, on-site temperature taking has not been shown to be an effective strategy to screen for COVID-19 in children, as the majority of cases in children do not present with fever during their course of illness. Should a student complain of fever while at school, a temperature check is recommended at that point. It is best to use the least intrusive method. And so what I alluded to before with regards to a non-contact thermometer will be used. And we need to ensure that the person using that thermometer is wearing a mask and some eye protection while they're using it.
Great, thank you very much. Can you speak, of course, masking? It's a huge issue for parents, and as our director just mentioned at the beginning of this presentation, we have changed our position, and many boards have been looking at this whole issue of masking. And the question that's just come in is about the use of non-medical masks in schools, specifically the importance of wearing masks, any harms associated with wearing a mask, and what a mask break might look like.
Yeah, so all excellent questions. So let me just remind everyone who's listening that the Ministry of Education requires students in grades 4 to 12 to wear non-medical or cloth masks while indoors on school property. And they're encouraging but don't require students from kindergarten to grade 3 to wear masks in indoor spaces. However, Director Miller did talk about the policy at Halton District School Board. And of course, reasonable exemptions on the requirement to wear masks will apply. Local public health units, such as Halton Region Public Health, do not determine masking policies in schools, but we have provided recommendations and consulted with our school boards in our region to inform the school board's decision-making. Currently, evidence on the use of masks in non-clinical settings, such as schools, is still emerging. Current evidence indicates that wearing a mask is likely helpful for the person who's wearing the mask, other people, rather than the person who's wearing the mask, because what it will do is hopefully keep the respiratory droplets inside the mask, but it won't protect the wearer from respiratory droplets from other people who are, not necessarily masking, because the non-medical masks do not filter these droplets from coming in. Overall, masks are safe to use, even amongst children. And in terms of risks, continued mask use may be associated with skin conditions such as facial skin lesions, rashes, and acne in younger age groups. There are also the potential risks related to language and social development, of course. And self-contamination can happen if individuals touch or move their masks with their dirty hands. Therefore, as I mentioned before, it's very important to incorporate good hand hygiene with mask use. I also want to touch on another point around mask use. Concerns have been raised about breathing in expired carbon dioxide while wearing a mask. For those without an underlying respiratory condition, it is highly unlikely that wearing a cloth face mask would cause a lack of oxygen or an increase in your body's carbon dioxide levels. In general, a cloth mask is not fitted so tightly around your face, and so it allows the passage of air around the mask and through the pores in the material. Carbon dioxide that you exhale will freely diffuse through your mask as you breathe. Also, healthcare workers who routinely wear medical masks for prolonged periods of time as part of their usual care do so without adverse effects. So I hope that is reassuring to everyone who's listening in today. Halton Region Public Health is supporting the development of age-appropriate mask education for our students, and will continue to support school administration in preparing for reopening. We understand that wearing a mask correctly for a full school day will be difficult for students, especially for our younger children and children with underlying medical, developmental, and mental health conditions. So it'll be important for schools to plan for mask breaks, as I mentioned before, with appropriate physical distancing during the school day to help children learn, practice regular hand washing and good mask behavior. Mask breaks can take place when staff or students are outside during recess, are being instructed outdoors, or for a short period of time inside the classroom, provided that physical distancing is always maintained. Each school board can set policies on to outline how mask breaks should be taken, and we will, of course, assist with that.
That's certainly good news, and we certainly always appreciate the support and resources that your department provides to us that we can then use with our staff to work with our students. And certainly part of our back to school process is going to be some extensive education and training with our students about many of the things that you've outlined, including we just got a question a few minutes ago about the whole idea of a mask break. And so I'm glad you were able to touch upon that. Next question, what will happen? We've all heard about the potential of a possible second wave this fall. As students head back to school, what will happen if there's a positive COVID-19 case or cases in a school?
Yeah, and I'm sure this is top of mind for all parents. So if there were to be a positive COVID-19 case in a school, public health is ready and prepared. Managing infectious diseases in the school system is part of our ongoing work, and we have considerable experience managing cases of infectious diseases, such as, for instance, pertussis, which also is known as whooping cough, and measles in schools. With any infectious disease, public health will work really quickly to using case and contact management and other measures to prevent further transmission. So in the event that there is a positive COVID-19 case in a school, a risk assessment and detailed contact tracing will occur. As each situation is going to be a bit unique, Halton Region Public Health will work closely with the schools to identify close contacts, and we will provide advice to close contacts and other individuals from the same cohort on exclusion or isolation requirements. Confidentiality of the confirmed case will be maintained to the greatest extent possible. The decision to shut down a classroom or school will depend on what we find during our risk assessment. We look at what's the likelihood that a confirmed case got the infection at the school and what their presence or activities at the school during the time when they may have been able to transmit disease to others was like. We'll also work with schools to provide appropriate communication to everyone involved. Earlier today, the province released its operational guidance for COVID-19 management in schools. This guidance will be used by public health and school boards to ensure the safety of staff and students if a COVID-19 outbreak happens in a school setting here in Halton.
Thank you. As we look to our next question, and I think it really picks up on something that came out of your presentation, it has to do with if one of their children tests positive, do all the children have to stay home and self-isolate as well? So could you speak to that issue with families with multiple children?
Yes, and this is, this is pertinent to not just the school setting, but for all of our community. When one member of a household is confirmed positive for COVID, it naturally means that everyone in the household, because they usually are deemed to be close contacts, must isolate as well. So I want to provide a little bit of background information as well. In May of 2020, I issued a class order under Section 22 of the Health Protection and Promotion Act, which is a very important piece of legislation that many of you have probably heard about by now, but probably had never heard about before in your lives. So the class order that I've issued legally requires all Halton residents to self-isolate if they have been diagnosed with COVID-19, have COVID-19-like symptoms, are awaiting test results and have symptoms, or are a close contact of an individual with COVID-19 or someone with symptoms. So that covers the household right there. Under the class order, all close contacts of a person who tests positive, including all household members, must self-isolate at home for 14 days. Close contacts are required to self-isolate for 14 days from the last known exposure to the individual who has COVID-19. So this may differ from family to family in terms of timelines, and our public health nurses will go through that guidance with that family. In addition, if a person has symptoms and is awaiting test results, the individual with symptoms and all of their close contacts, including their household members, must self-isolate. So we have a lot of information available on how to self-isolate. And if you wish to find out more information about that, you can go to our website at halton.ca/COVID-19 and scroll down to the COVID-19 health advice area to look for self-isolation. So I hope that's helpful in answering that question.
It definitely was. Thank you so much, Dr. Meghani, for joining us this evening. We know at this time, your time is extremely valuable, and we'd just like to reiterate on behalf of the Board of Trustees and the senior team very much how much we appreciate our relationship with you and with your department, and the tremendous support and access, unfettered access that we've had in order to help shape some really critical decisions in our reopening schools plan. So thank you very much for joining us.
Thank you, Rob. And again, thank you to all of the school board staff for the immense amount of effort that has been done over the last few months. And just a quick moment to say to all parents, again, reiterating that the decision that's right for you is right for you. And this is a very important time for the whole community. And I just want to take the opportunity to let you know that we're here for you. And if you have any questions, please do reach out and go on our website or call our call center. Thank you again.
Thank you so much. At this point in our agenda, we're going to move into speaking more specifically about the evolving situation within our elementary schools reopening plan, and really looking at some of the specific questions that relate to our students in grades kindergarten through to grade 8. So with that, I'm going to ask Superintendent Salmini to join us online, and would ask her to maybe start off with telling us a little bit about what might be an example or outline of a typical day for students in our elementary schools.
Certainly, and if I could get my slides put up, I will first talk about the in-person full return instructional model. So for our students who are returning in person for the full instructional model, they are going to have a 300 minutes a day of instruction, as they always have, with regular school hours. You'll notice on the left-hand side that that would include a 100-minute block, 2 periods usually in that block, and then a break. And we're allowing flex time during those breaks for staggered supervision and for time for snacks in room and then for outdoor play, followed by another 100-minute instructional block, followed by another break, and again, the third 100-minute instructional block. All of our students will be experiencing the full Ontario curriculum for all subject areas in this model. They will remain in one cohort, so a homeroom class, during their day of instruction, and any staff that would be teaching the class will be the ones that move. I will note also that we are trying to limit the number of teacher contacts for every homeroom class cohort as much as possible. And so that will be built into the schedule. We will preserve these cohorts for breaks. So when they go outside, we will be keeping them in the cohort that they have inside. We are really encouraging enhanced learning opportunities outdoors for our students in this model. We will schedule washroom and hand hygiene breaks before and after breaks during the day, and entry and dismissal routines will be revised to reduce contact, and individual schools will be communicating this prior to the first day of school, what that will look like for those classes in individual schools. Common spaces will be closed for unscheduled student use as well during this model. If you could move to the next slide, please. So this is our full distance instructional model, and our plan is to replicate as much as possible what our students in physical school will be experiencing during this model. They will also have access within a 300-minute day in their Google Classroom. Distance learning will be delivered by staff in our virtual school, and so this may or may not be students, teachers that your children may be familiar with. They could be from other schools. The duration of synchronous learning will vary between kindergarten and grades 1 to 8. So in PPM 164, the minutes set by the ministry are 180 synchronous minutes of learning for kindergarten students, with 225 synchronous minutes for grades 1 to 8. Students from multiple schools will be assigned to the same distance learning classroom, so they may have familiar faces in there, and we will try to do that, but there may be and are likely to be students that they don't know as well. In terms of French immersion, we'll make every effort to provide instruction in French for our students that are in French immersion. If that is not possible due to the requests and staffing, students will be able to return when they return to a physical school into the French immersion program, even if they haven't had it in the distance model. But our goal is to provide French immersion in our virtual schools as well. If you'll look at the sample timetable, again, 3 blocks with the breaks in between, just like in the physical school. There will be a balance of whole group synchronous instruction, small group synchronous instruction, and also time for students to be working on asynchronous extensions to their learning so that they're not constantly on the screen during that time. Again, the full curriculum will be taught, Ontario curriculum, all subject areas in the distance model. It just may look different than it does in a physical school because of some of the limitations in terms of being virtual. And that's an overview of the 2 models. And so I turn it over to Superintendent Etoff for some more specific questions.
Thanks very much. And maybe just before, maybe you could just put yourself on mute there for a minute, Superintendent Salmini. Thank you. Maybe just before moving on to some other some questions specific to our elementary model. I think it's important to note that all of our plans, elementary and secondary reopening plans, of course, were developed in partnership and in some cases through approval processes with the Ministry of Education, as well as in compliance with our public health guidelines. So I think that's certainly worthy of note. And I think a second point would be that all this information is on our website. So if individuals want to do a bit of a deeper dive into some of the information that Superintendent Salmini has shared with respect to the elementary model, that is certainly available to you at www.hdsb.ca. So with that, Superintendent Salmini, I've got a question here with respect to kindergarten. What is the kindergarten program going to look like, and how is play-based learning going to be implemented? What's the plan for students entering JK, and are they going to meet their teacher beforehand? Is there going to be a virtual tour of the classroom? So lots of concern about entering the school system for the first time in those earliest of years, of grades. And what that might look like within that play-based model. So could you please comment on that?
Certainly, and we have received many questions about kindergarten and understand that families with these young children are really wanting to know what it might look like. And so I will tell you that the kindergarten program will continue to be play and inquiry based with health and safety protocols followed, so that it will look different than it may have in typical times. We really are encouraging the use of that outdoor space for learning to allow for greater physical distancing. So you might see one educator take a group of students outside while the other educator is inside with the other students. We're planning on having our students placed in small groups, and they will sit at their table groups in these small groups, and they will access any kindergarten centers in these small groups as a bubble for a period of time. Many learning materials will be organized in separate containers for students with labeled with their name, so they won't be sharing them. We're also going to be having individual sensory materials for students rather than communal sand and water tables and things that we are used to in a kindergarten classroom. Classroom cleaning protocols will be in place for any shared materials, because we do know the nature of the program is that there will be some materials that may be shared, like the large hard surface blocks, those kinds of things. Plush items will not be used in the kindergarten classrooms. Student cubbies will be accessed in small groups, small cohort groups. Entry procedures for kindergarten students will be communicated to families, because we know we get many questions about what will that look like from their individual schools, because they may vary based on the school's configuration. School teams will use all the information that we provided based, as you said, on the direction of Public Health and the Ministry of Education to develop the best school protocols for their kindergarten classrooms. And so really, kindergarten educators will be using small groupings, the use of outdoor space, individual materials, and enhanced cleaning protocols to provide an inquiry-based program that is as much as it can be a typical year in terms of play and inquiry. But it will look different because of some of the protocols and the things that we have had to change. And in terms of a staggered start, because I know that you asked about that and about JK, as Director Miller stated earlier, all students will likely have, we're endeavoring to have some sort of a staggered start. So this would allow for some orientation and teaching of the health protocols in smaller groups, and that would apply to junior kindergarten students as well. And again, families will receive information from the school, which will outline startup, orientation, all of those pieces for our youngest students in junior kindergarten that will be site specific.
Thank you very much, Superintendent Salmini. And I think that's a very relevant point. Lots of the questions that have come in tonight and over the last couple of days are really school specific, really related to the procedures and routines at their specific home school. So I know a lot more information will be coming out from those schools to their communities in the coming days, and I think we'll do a great deal to answer many of those questions. But you also did speak about the fact and mentioned about this notion of outdoor education and outdoor play. And so another question has come in here about, will elementary students have outdoor recess? And if so, how will this be monitored to ensure classes stay in their class cohort while outside?
Thank you. That's a very good question. And the simple answer is yes, they will have outdoor recess time. We think that's very important for students, especially during this time. And schools will develop protocols to keep cohorts apart. And so I'll just give you some suggestions as to what that might look like. Certainly rotating eating and outdoor portion of breaks so that no more than half of the school population is outside at any given point. Planning to divide the playground into distinct areas for cohorts, and that would be dependent on each school site. Really, we're going to be relying on teachers teaching, rehearsing, and supporting all of the new routines, and not just in the first week, but on a continual basis, so that students really understand how it is, how important it is, and how they can play outside while remaining in their cohorts. We're suggesting the use of track and field paint, pylons, natural boundaries to frame sort of divisions within the yard, where you're teaching games and activities that can be played with low to no materials and in a contained space, so that students will know what to do when they go outside and need to remain in their cohort. And really training any supervision staff out there to monitor effectively during outdoor breaks, so that all of these established routines that we're putting in place are implemented effectively. So those are just some of the strategies, but students definitely will be going outside, and we have provided as a board many strategies and suggestions for our school-based action teams to be able to operationalize this important part of a student's school day.
Thank you very much. And over the last couple of days, sorry, if you just wouldn't mind muting Superintendent Salmi. Thank you. Certainly, one of the pieces that we have been hearing quite a bit about is, beyond kind of the regular core learning, what about phys ed? What about art? What about music? Some of those Rotary type subject areas. What will they look like in elementary schools for in-person and for those who select distance learning? Some teachers, such as music teachers, go into each classroom. So some of these teachers are seeing many students each day. Are any additional precautions being made or alternative solutions for everyone's safety? So if you could just respond to that question coming in from our community.
Thank you. Yes. So grade 1 to 6, art, music, and phys ed may be taught by the homeroom teacher, possibly by another teacher, but likely by the homeroom teacher. In our grade 7 and 8 classes, music and phys ed will be taught by a specialty teacher, and art will likely be taught by the homeroom teacher, but at some schools it may be a planning time teacher that teaches art. And that would be in both learning environments, whether it is in the physical learning environment or in one of our virtual school environments. In terms of physical and health education in the face-to-face environment, it will need to be taught either outside or in the classroom. And we know that this is going to pose unique challenges for our staff because our gymnasiums will not be in use as we begin because of the issues around being able to effectively clean them between cohorts. So we will be teaching outside or in the classroom. And in the virtual environment, teachers will focus on curriculum expectations that can be achieved at a distance, again, in the area of physical and health education. And the school programs department has been working on support documents and resources for teachers in planning activities and learning opportunities for both environments, because we know that physical education is going to look different in both settings. In terms of music instruction in the physical environment, it will look different as well. Teachers will focus on non-instrumental music as we begin, and we'll revisit this as time goes on in consultation with our public health department. Singing will only be able to take place outdoors with proper distancing. And again, we will follow direction from public health and in consultation with them, make any changes to this decision. In the virtual environment, teachers will also focus on overall expectations to begin and tailor their instruction to participation online at home. Because again, music instruction virtually will pose some challenges. Trying to cover the overall expectations and then moving forward as we get new direction as things change throughout the first semester. Art planning will also be adapted to the new environments, and there is an emphasis on integrating art, if possible, with other curriculum areas in the homeroom class, and that is the direction that we are giving. And now some schools may have the planning time teacher be an art teacher, but we really are encouraging integration, and that it is a homeroom model and that the homeroom teacher be providing that instruction. The question around teachers who go to multiple classes, certainly our students are going to be remaining in their homeroom class during the day, and any teachers will come into their class. They will be wearing PPE, and they'll adhere to the protocols that we have in place in terms of teachers teaching from a specific area in the room that is distanced from the students. Part of this protocol also includes additional PPE for the teacher in the event that they need to leave the teaching zone and move in closer with the students. So those are some of the additional protocols for teachers that need to travel from classroom to classroom.
Thank you very much, Superintendent Salmini. Very much appreciate your responses to those questions, and we may get back to you a little bit later if some further questions come in from that particular area. But at this point, I'd like to transition over to some secondary questions, and I'll be calling on Superintendent Hunt-Gibbons. It has certainly been a very challenging time over the last number of weeks as we've been asked to relook at our models and to respond to new directives from the ministry. So maybe just to start off with, Superintendent Hunt-Gibbons, if you wouldn't mind just maybe providing a bit of an overview of our newest direction and this whole notion of quadmasters and what that looks like.
Most certainly. Thank you, Superintendent Etoff. There will be some slides showing on the screen momentarily. We're going to start with a basic overview, as high schools are complicated places. So traditionally, we teach high school in 2 semesters. The first semester goes from September until the end of January, and the second semester goes from February till the end of June. During that time, a student would take 8 courses as a regular course load. So now when we talk about quadmasters, we're still taking 8 courses, but what happens is that it divides those semesters in 2 so that students can focus on 2 courses rather than 4 courses. And so the color-coded diagram you see before you, I think, will help people understand how it is conceptualized and how it is compartmentalized. So there are 4 quads over the course of the year, and a student will take 2 courses in each of those quads for 10 weeks each. So if I happen to be taking math and history in my first quad, that's all I'm going to take for those first 10 weeks. Rather than if I were in a regular, I would be taking 4 courses. And that was our original model. For those of you who have been following along from the very beginning, we had a model that was approved by the ministry that had our students seeing all of their courses and rotating through them over the course of a semester, trying to maintain as much normalcy as possible. We then received information saying that we needed to ensure that students who were opting for distance learning we're going to be provided with a minimum of 225 synchronous learning minutes at a time in any given day. And so what that meant is we needed to relook at our model. We created a virtual school in Halton, and we took the opportunity to reflect on some public feedback. And the number one piece we heard from families and from students was that 4 courses was too much to manage, and they wanted to see if we could simplify it. And so we did, and we moved to this quadmester model that you see before you, where students will focus on 2 courses at a time, and they'll complete those 2 courses, and then they'll put them to bed and move on to another 2 courses. And they'll do that as they rotate through the year. If your student does not take a full course load of 8, then they're going to see a little bit of imbalance through that. So some of our senior students, as they're closer to graduation, are taking 7 courses or 6 courses. But if you have a student in grade 9 or 10, your quad will look very much like you're seeing on the screen before you. So if we can go to the next slide. So I recognize there's a lot of information on this slide, and it may be hard to see depending what you're viewing this presentation on. So all of this information, including these models, can be found on our Return to School plan on the board website. So if this is hard on your eyes, please do go and look there. But this model here, what it looks like for a student, is that we maintained our focus on face-to-face, in-person learning. And so we have a skewed day. You'll see in the blue in course 1 that students are coming in person for 180 minutes. Again, this was part of our original model and remains in recognition of the feedback that people really valued the face-to-face time in person rather than on the computer. And so we have the same course that will run all week. Students will come in either by foot, bicycle, or bus, whatever their mode of transportation, or maybe it's mom and dad. They will stay for the 180 minutes. They will transition home, where they will then have 120 synchronous minutes on their second course. So they only have 2 courses, and this is what they're dealing with every day. So they're seeing that morning teacher face-to-face in person, and then in the afternoon they're seeing face-to-face, but it's online the way you're seeing me right now. We have maintained the full course all week as part of the cohorting protocols, and you'll notice that we have to split our week. So we have cohorts A and B in our secondary schools, and this is because we're a designated school board. So as a designated school board, that means that the ministry has said that as an urban center, we have to cohort our students in groups of 15. And so we're using an AAABB model. The following week, it'll even out so that the students would have AABBB. So the flip day is always our Wednesday, and students are in on their designated day. We're going to help them with knowing their designated day by color coding and providing a tag they can attach to their book bag so that they're aware of what their cohort is. And this will help them keep their time straight. We will also send home a schedule, and schools will be sending regular updates as well to help everyone understand this new schedule, as it's new for staff as it is for students. The question has come up, what happens when cohort A is in class, in person, and I'm in cohort B? It is not time off in any way. It is instructional time. Cohort B is not there in person in front of the teacher, but cohort B, when cohort A is at the school, will be working on synchronously or asynchronous work for that class. Everyone is getting the same number of instructional minutes, and they're getting the same number of instructional minutes they would be getting in a traditional semestered model. It's just that we've condensed 2 courses into 10 weeks. This schedule will go for the 10 weeks, and then students will have another 2 courses. And of course, as you saw from the survey, we are also offering an opportunity to change your mind in terms of your learning preference between this blended model in person or whether you'd prefer the virtual model. So if we look to the next slide, just to simplify it even further. So in here, we've actually put names to it. So this is a sample in-person timetable for a student. And this student is taking math and drama in their quadmester. And so you can see that they're coming in the morning for their math class, and they're going to be there depending on whether they're in cohort A or B. Regardless, they'll be working on their math in the mornings. They're going to transition home, grab something to eat, and then they're going to be online working synchronously with their teacher. In this case, we're showing you a drama timetable, and the students are no longer cohorted. There's no cap on that because they're not actually in person, so there's no public health considerations to worry about. So all the students in the drama class in the afternoon will be together online, cohort A and B, for 120 minutes in the afternoon. This will flip bi-weekly, and you can see it on the bottom as the colors flip from yellow to blue as we go through the various weeks. This slide only goes to week 5. That is simply because we couldn't squish up to week 10, but there are 10 weeks within a quadmester. We'll look to our next slide, and this is our distance learning. So if you've opted to learn fully distance and you're not coming into the school, then you are working out of our virtual high school. So the new acronym that students will start using in your home is VSS, Virtual Secondary School. And their timetable is very, very similar. They have 2 courses. So in this case, we've mirrored the same one. They have math in the morning and they have drama in the afternoon. They also have a 75-minute break in the middle of the day so they can get something to eat and have a change of scenery. The only difference in this model is that you can see that there isn't a skewing of the minutes in the day. There are still 300 instructional minutes provided, but in our virtual school, they're 150 and 150 rather than 180 plus 120. And that is because it's the exact same learning platform, so there's no need to skew that in order to have more in-person, face-to-face time. But I remind everyone in the other model, those minutes all work out the exact same way that they do here for math and drama in our virtual school model. Our communities pathway students, so our CPP students, they're coming in every day. And if they've opted for fully distance, then their IEP will be reviewed and their special ed staff will be in touch with them to let them know specifically at home what that's going to look like. So at this point, Superintendent Etoff, I've explained the models, and I think the slides can now disappear. And if there are questions that you would like to ask, please do.
Superintendent Hunt-Gibbons, can I just add one thing, Robbie Toff? It's Director Miller. I think it's important for the public to understand that the virtual schools that we have created, 3 in elementary and 1 in secondary, we have essentially started schools from scratch. All boards are doing this, and they're all having the same growing pains and the challenges in staffing these schools and the organization of these schools. But we have about 16,000 students who have chosen virtual school, and we will have to staff those, get administrators in there, redeploy staff, and do all those other things necessary to get a school up and running. So I think it's important that the public understands that these virtual schools did not exist until about 3 days ago, where we started working on it once all the intent to return came in. So with that, I will turn it back to Superintendent Hunt-Gibbons. Thank you.
Thank you very much, Director Miller. Yes, certainly no small feat given the timelines, and our hats very much go off to Superintendent Hunt-Gibbons and her team, who've been working incredibly hard 7 days a week, pretty much 24 hours a day to pull these models together. With respect to the next question, it has to do with cohorts, and I was just wondering if you could the question is, how will cohorts A and B be determined for secondary school? So could you take a moment just to comment on that, Superintendent Hunt-Gibbons?
Certainly, and I was hearing feedback there with Rob Etoff, so I'm going to repeat that question if anyone else was also having feedback. And the question is about how do we build the cohorts in secondary schools? So the first thing we have to do right now is build the classes and timetable them all. There are inevitably in any timetable conflicts that need to be resolved. And so once our guidance counselors have resolved the conflicts, then the secondary schools will build class cohorts of students. And they're going to do so primarily based on last name and transportation requirements. Other balancing factors will also be considered. And we're going to give colored tags for bus students, and in fact for all students, just to help them understand what cohort they're in. And in the case of our bus students, this is going to help our bus driver as well as the students determine what cohort day it happens to be. Red and blue are the colors I'm thinking are coming to all of the schools next week.
Thanks very much. I appreciate that. That certainly gives us a good outline in terms of how those will be established. Of course, lots of questions coming in, even though this is a long way off, with respect to exams and how that's going to look within quadmesters. So the questions are: when will these exams occur? How will this work for those students in person? And would the exam for in-person option be done through Brightspace so the assessment is fair both for the in-person and online cohort?
Thank you. So examinations are not a requirement in the province of Ontario. In fact, there is an assessment evaluation policy document for anyone who's interested. It's called Growing Success. And the Growing Success policy document indicates that our secondary school courses are broken into a 70% term and a 30% final. But that 30% final is in no way a requirement for an exam. An exam is just one way that a student can demonstrate their mastery of the course material. It is not our intention to run examination days at the end of these courses. It would be very difficult with the cohorts, etc., and we would be spending precious time bringing students in to sit these. So we are going to use that flexibility within the policy document, and we are going to run instructional days throughout, which means that our teachers are going to determine the assessment and evaluation for the final 30. And it will be scheduled on the instructional days. So the types of things that people could anticipate is they might see a summative test, they might see a performance assignment of some sort, they could see an essay, they could see a lab report. There are many things that fit the bill of assessment and evaluation for the final 30 for students. Students will be aware of what this is. Information will be going home so that families are also aware of when this is taking place within the course. And processes will be in place and best practices shared with teachers. I know that there has been some conversation around making sure that assessment and evaluation is fair and favorable, regardless of where you're choosing to do your learning, whether in front of a teacher within the same classroom or at a virtual school where you're online. And this will all be coming out later this fall, but there is no plan for final exam days in Halton Secondary.
Thank you very much, Superintendent Hunt-Gibbons. And I know I was experiencing some technical difficulties, so I'm hoping that the sound quality is a little better. I think actually at this point, I'm going to move over, and we may be coming back to you though. So please don't go away. But actually, this question is actually for the chair of the board, Chair Gerbens. How did the board make use of the reserve funds that are now available and were made available recently? Why are we not using available funds to ensure the safety of our children, hire more teachers to reduce class size. And as a result of the federal government announcement today of $2 billion for schools, will the elementary class sizes now be reduced? So that's a bit of a mouthful, but maybe if you could just provide some general commentary with respect to the recent funding announcements.
Okay, thank you. So the funding announcement on the 13th of August allowed boards to unlock their reserve funds, a portion of their reserve funds, to be able to put towards COVID issues within their district. And that amounted to just over $7 million for us, which would allow us to hire about 78 elementary school teachers. And that is not enough to even put one teacher in every elementary school in our board. So we would need to hire 1,200 elementary school teachers to be able to make that happen. So even with the funding that is coming in, that will still put us nowhere near the amount that we need to spread out every elementary classroom to meet 15-to-1 student ratio. So, and that's just looking at teachers. We would also need to acquire space. Space also costs money. In many of our more packed areas, there isn't a lot of space anywhere, anyways within the community. That's in North Oakville, South Milton. And on top of that, we would need to have more custodial staff, more cleaning supplies. We have to make sure students are in safe environments. We could never be in places where the community shares washrooms with students. There's a lot of things to consider. So staff are looking at the funding that just was announced today, and we will allocate that money in the best way possible to support students and staff.
Thank you very much, Chair Gerbens, and I know it was a bit of an unfair question, certainly with respect to the announcement today, and appreciate that the board will now need to take some time to look at what proportion of that money will be receiving, and then how best to utilize that in our system in order to support our system. I'm going to now call upon Superintendent Podjabarek. Just wanted to look at this whole piece around special education. Certainly have some questions that have come in with respect to that. And one of the questions that has come in here today is, will the same staff remain in a self-contained class for the full school day while the pandemic is a threat? So within the reopening schools model, what is that going to look like within those regional self-contained special education classes? Would you mind commenting on that, please?
Hello and good evening. Thank you for the question. Self-contained classes are supported by a number of staff in various roles. During the pandemic, we're trying to limit the number of staff that work in these classes, and indeed in all classes. However, knowing that these students need a variety of services in a host of supports, and that staff need breaks and to honor contracts, we are fully expecting that there will be additional staff in the room meeting all of our protocols to support these students. So it won't be a single staff member trying to deliver all of the supports. It will be still a team effort in the self-contained classes.
Thank you very much, Superintendent Podjabarek, and I'm going to keep you on line here just for a minute because I have another question that we'd like to share with you. Is there any way that parents with special needs students can do a trial run of in-person and/or distance learning to determine what works best for their child? Are you able to comment at all on this notion?
Yeah, the very quick answer there is yes. Similar to other students, there is a window in the end of November after the progress reports are issued. Certainly, that's an open opportunity for parents to revisit and talk to staff and see how the program's working for their child, meeting their child's specific individual needs. So we're asking parents to abide by that November. If there are exceptional circumstances, you can always reach out to the virtual school principal or your in-school principal and have some dialogue around that. But those would be isolated in case-by-case situations. So I thank you for that question.
And I'm going to give you one final one for now within the area of special education and supporting our special education students. And it's one that I've received specific emails on, certainly over the last number of weeks, and it very much relates to the whole notion of masking. How will you accommodate deaf and hard of hearing students while staff are wearing masks that prevent lip reading?
There's a number of ways we're looking to address that. We're working the ministry. There is the notion of sourcing clear masks, and we're working with public health as well as the ministry to see if those will meet standards. It's certainly a direction for us to look at. And certainly we have plexi screens, which can divide a staff and a student, and in a one-on-one or very small group opportunities, be used to deliver instruction again that won't impair the vision of the face or the mouth area. So there's a host of ways around that. Thanks for that.
Thanks very much, Superintendent Podjubarek. I'm now going to call upon Superintendent Ruddick. She is a part of her portfolio is student health. So she has obviously been working very, very closely with our health department authorities. I think just in general, maybe if you could start with some broad commentary in terms of where we're at with respect to some of the ongoing changes and modifications of policy. But then if you could tell us a little bit about how school routines will be altered in order to minimize student to student or student to staff contact.
Certainly. Good evening, everyone. Yes, the health portfolio has been a very busy one in the last 6 months, and we have been learning a great deal about COVID and preventative strategies to mitigate some risk. And the information from the ministry is also continuing to evolve. So some of you may know that earlier today, the ministry released some new information on how schools are to manage students with symptoms or confirmed cases of COVID in the community. And this is all very new information and may be different from the information that we have in our plans and the plans that we have developed in consultation with public health. So all that to say that, the information that I will share this evening really addresses our current plan, and our current plan will certainly be looked at over the next couple of days in light of the new information that is being shared by the ministry. We'll go back to public health and consult some more to make sure that our protocols and our expectations in schools align with Dr. Meghani's and the region of Halton's public health unit. And then we will update our plan. So what I say today could change over the next few days. But with regards to your question around what routines will be in place in schools to reduce contact, Much of our life in schools will look the same, and we are really looking forward to having kids back in our buildings to hear their laughter, see their smiles, and get back to what we do best, and that's teaching and learning. But many things will look different. And that starts right from the time when you enter on our front door, or sorry, even before you enter, I should say that it starts at home. And that's with the expectation that there is a daily screening, checking for symptoms to make sure that every child that comes to school is feeling well and isn't exhibiting a symptom. That same signage will be on our front doors, reminding everyone that before entering the building, that daily self-assessment must be completed. There will also be other posters to remind students about some of the preventative measures, such as physical distancing, wearing a mask, respiratory hygiene, hand hygiene. So lots of visual cues to remind students of some new habits will be forming. Directional arrows will be placed in key locations in the hallway to make sure that students know to space apart. Some of our hallways will become one directional. Some staircases will become one directional, and entrances and exits will be designated to mitigate some of that close contact. In our classrooms, we'll see seating look different. Desks will be spaced apart to the extent possible. This will vary from room to room and from grade to grade, really depending on the size of the space and how many students are in the classroom. But we know that in our classes, we'll have our tables spaced 1 to 2 meters apart. We'll have hand sanitizing stations located at the entrances, in key locations in the hallway, and in our classrooms that don't have sinks. And we will also see that students are cohorted. In secondary school, we know that those cohorts are cohorts of a max of 15, and in our elementary schools, the cohort will be that student's class. And that cohort will have a schedule that's designed for them that reduces contact with other cohorts when they're in the hallway or when they're outside. Some of the common areas in the school, as Superintendent Salmini has already explained, will be closed so that there's not a different usage or usage between different cohorts when that cleaning and disinfecting cannot occur in between. We'll see also some of the structure of the day to include lots of hand hygiene breaks, whether that's using hand sanitizer or hand washing. And we'll see more outdoor breaks, whether it's outdoors for learning, outdoors for a body break. But we know that our students will need a break from wearing a mask. And so those increased structured opportunities outside will occur. For parents, you'll also see that we have a no visitors policy. And this is a significant change for how we typically operate schools. We typically welcome our parents and guardians and volunteers and other community partners into the school. And sadly, this is going to have to change for the time being. So we still want to maintain that connection, maintain that partnership with our families. But for now, it will have to be done from a distance and virtually. So prior to the first day of school, our staff will be trained in all of these new routines so that we can be sure that we're welcoming our students back in a really safe way.
Thank you so much for that a very detailed response, and I can certainly speak firsthand to the signage and visual cues that are out in our schools. I visited one of my schools the other day, and they were up and ready for our students. And we're just in the process of putting some final touches on a school reopening schools video for both elementary and secondary. We're looking to get those out to our communities next week to give our families a real firsthand look on what they can expect, and more importantly, what students can expect as they head back to school in the next couple of weeks. I have a couple of more questions for you. And I'm just going to go here. I think the next question, lots of questions actually coming in about this whole notion of social distancing. Why is 2 meters distance required everywhere else, but only 1 meter distance is required in elementary schools? Would you mind commenting on that particular question that's come into us this evening?
So in all of our schools, every classroom looks different, and every school is different. And we don't have the same square footage from space to space and room to room, nor do we have the same number of students in space to space and room to room. So we know that in secondary school, our cohorts are capped at 15, given that the ministry has required us to open in an adaptive model. And this will allow for 2 meters of spacing between student chairs. In our elementary model, the ministry is requiring us to do a full return to school, and that means that the full class will return. So depending on the size of the class and depending on the size of the room, the chairs will be spaced as much as possible. In a primary class where we have 20 students, it's likely that we will achieve the 2 meter distance. In an intermediate class where there's 24 students in a room, it will be somewhere between 1 to 2 meters. So depending on the size of the room, size of the class, that physical distancing will be implemented as much as possible. The physical distancing, however, isn't just in the classroom. The physical distancing will, of course, continue in hallways as students move through the hallways and when they're cohorted outside at nutrition breaks and during outdoor learning times.
Thank you very much. I have one more question for you, if that's okay, and it's specific to the announcement of Director Miller at the beginning of our session, where we announced that we would now be requiring implementing masking for grades 1 through 3. So this question that's come in specifically asking, why have you decided to implement masks for grades 1 through 3 now?
Thank you. Wearing a mask is an evolving strategy. Certainly, we see the prevalence and acceptance of wearing a mask really change dramatically over the last 4 to 6 weeks in our communities. It was only a month ago that the ministry announced that masks would be mandatory for all students in grades 4 through 12, and strongly encouraged but optional for kindergarten to grade 3. While we know that children under the age of 10 are not strong spreaders of this virus, we also know that there's a lot we still have to learn about this virus. And so we turned to Dr. Meghani, our medical officer in the public health unit, to seek some insight from her, even more so as we've been really focusing on this issue in the past week. And with her advice, we decided that we would take this step as an added layer, in addition to all of the other preventative measures that we are putting in place in schools, that we would add this additional layer and have our students in grades 1 to 3 wear masks. You know, we appreciate that this is a new skill. It's a new skill for all of us, and it will be certainly a new skill to develop with our youngest students. But in education, that's what we do. We're in the business of supporting students and developing new skills. And that will certainly be the approach that we take with all of our students, and most importantly, with our youngest students, to develop an understanding on why wearing a mask is beneficial to others, how to wear a mask safely, and to build a tolerance and an acceptance for wearing a mask in school. As we've heard from a few folks this evening, that will involve certainly some breaks from wearing a mask throughout the day while outdoors, and whether that's at a break time or taking the learning outdoors. We recognize that all of our students, and in particular our youngest students, will need this break. We also know that for some students, wearing a mask simply isn't appropriate based on a medical condition or a developmental stage. And so for that reason, we have an exemption process, and that exemption will be approved through the principal. And so part of our education will also involve building an understanding and a sense of compassion for our students who aren't wearing a mask. And so this is certainly an important focus in our initial weeks in school.
Thank you very much, Superintendent Ruddock. I am now going to move over into some some questions related to general operations of our schools. I'm going to call on Superintendent Blackwell, if that's okay. Many questions coming in. Really, and some of them are more comments than questions per se, all about anxiety that students are feeling about returning to school, and again what that's going to look like. And so therefore lots of concerns around mental health and well-being of our students. So the specific question that I pulled is, what is being implemented to support the mental health and well-being of our students? Superintendent Blackwell?
Yes, thank you, and good evening, everyone. Very important question. I know that, we've sat here and listened to program and talked about curriculum and instruction, and just as important in our board is the mental health and well-being focus that we've had for years. With that being said, we know that the students that are coming back to us in the fall, whether it be in virtual school or in their home school, may come back to us with different needs than when they left. So we first like to thank families who participated in our distance learning and mental health survey in June. That information has been invaluable. It is actually posted at our Reopening Schools webpage if you wanted to take a look at that. But it gives us a sense of the needs that we will have in our system in terms of supporting the students in coming back this year. And so a well-being action team has been in place since the spring, focusing on preparing to welcome our students back, and also making sure that the resources and the supports will be available to students. So whether they're in school or whether they're physically, or if they're learning online, we have staff that support mental health and well-being. We might have a child and youth counselor or a school social worker that's available. We also have all of our staff who will be participating on the PD days prior to students arriving that will be engaged in professional learning specifically around mental health and well-being. And it'll have a strong focus on building students' social emotional learning skills as they continue to build resilience, manage their stress, and build positive relationships. So whether that's in the school or virtually, we did have some summer learning programs this year, and it was really interesting to hear the feedback from those programs where kids were learning from distance. And the ideas that teachers used and strategies to make sure that they were able to engage with each other and really build that sense of community. So, that is a focus for us. Last week, School Mental Health Ontario released additional resources. They're amazing. They're worth a look. We've linked them in our website in the last couple of days. And we also have a board website that has posted resources and tips for parents and caregivers in terms of getting ready to come back. Our students with special needs will be offered opportunities, transition supports. Many families have already been contacted by schools just to help students be ready to come back. And also, as Superintendent Etoff mentioned, there's a video that will be released to families on the 31st of August, a secondary one and an elementary one, because they're very different, in which students will get an understanding of what they're coming back to, And as Superintendent Ruddock mentioned, there's lots of things that are going to be the same. And we know that people and relationships are a big part of what we do in our board. And that will be something that we will continue to build upon.
Thank you very much. I'm going to have you stay online. I've got another question for you, and it relates to busing. Many of our students in the Halton District School Board require transportation and are eligible for transportation in order to access their schools and their programming. This question that has come in is, will there be assigned seating on school buses? How do we distance kids on the bus and make sure they are all wearing masks at all times?
There's a lot of absolutes there. So I guess the easiest thing is to consider, all of us know what a school bus looks like, and there's shared spaces where physical distancing isn't possible on the vehicles. Buses may and will probably be loaded to capacity. We have shared busing with our coterminous board, and a very efficient system. And efficiency means that buses are loaded and optimized for their routes. So students will sit in 2 to 3 per seat, as they always have on a full-size bus, and seats will be assigned by school administrators and with priority. So we would want children from the same home to sit together. Given that it's not physical distance can't be maintained, non-medical masks or face coverings are required for grades 1 to 8, as we just mentioned this evening, and strongly recommended for kindergarten. Families where your children are riding the bus, I would recommend strongly that you look at the information that's being posted at Halton Student Transportation Services website. They have a webpage dedicated to COVID-19, which includes information about the cleaning protocols, the PPE that's available for drivers, the masking piece, ventilation, and really gives parents some information to help inform their decisions about riding the bus.
Thank you very much. We know that's certainly a big area of interest for our students, and we know that arriving safely to school is foremost for parents at any time, but especially during these situations and with the additional protocols in place. We're now going to move into a couple of questions related to our brand new virtual schools. We have, I think it's around 16,000 students or so within our board that have selected to not return to our school buildings in September and have selected virtual school instead. So we are currently in process of setting up multiple elementary virtual sites, as well as a secondary one. So we have a couple of questions there, and I think it's you might be best to answer it, Superintendent Blackwell. And the first question is, will there be an effort to put students into virtual classrooms with other kids from their school?
The short answer is yes. We will be trying to do that. I know that the virtual schools that we're establishing right now, we are establishing them by region in our elementary schools. Our secondary schools will be different. And again, that will be a little bit trickier because students are selecting their courses. It's not the set program for an elementary grade. So for elementary, where possible, we'll be trying to do that. And secondary, course selection and program pathway will be the priority, but again, trying to make sure that students are connected to each other.
Thank you. And I have another question that's come in with respect to virtual schools as well. What's the maximum number of students that can be in a virtual class grouping?
So it's a good question, and it's a question that that kind of falls into another question that I've had around virtual, so I'll kind of group them together. Classes are staffed in accordance with the class size regulations, similar to the way they would be in a school, in school classes, so in regular times. Keep in mind that there is cohorting in high school, so kids are coming in classes of 15. That won't exist in distance learning for the virtual school for secondary students, because they don't have to worry about that distancing piece. The other part to that question was, families have asked, can we switch back and forth into virtual school from in school? This class size limitation is why we've had to say we are going to set different times throughout the year where families can reconsider their choice. But again, we're working within the parameters of our class size regulations and staff working with kids.
Just before moving on, I know that we have Superintendent McFadden, who's our Human Resources Officer. I'm just wondering whether she has anything further to add with respect to class sizes and staffing.
Yes, thank you, Superintendent Etoff. We also have class size guidelines in our secondary collective agreement that will be maintained at the virtual school. So depending on the subject area of the class, those class sizes will all be honored. So they will be as per a normal secondary school based on the new class size averages and the funding formula of the Ministry of Education. So we will not be having class sizes over our normal maxima that we would see in a regular secondary school in normal times.
Thank you very much for that clarification. Hard to believe, but we're already at 9 o'clock. So we're going to go with one last question. I'm going to direct that to I think Superintendent Podjaberic. And it's with respect to safety and security of our buildings and our policies that are related to those. So the question is, will there be revisions to the school visitor policy for safety reasons to ensure unauthorized individuals do not gain access to the schools?
Thanks for the question. Absolutely, there will be. Just the nature of COVID and the outbreak necessitates a no parent and no visitor policy. So we won't have external bodies in our school. Even parent drop-off pickup will all be coordinated outside of the school. There'll be lots of signage posted on all the doorways and communications from all schools specifically around that. In addition to this, also just to control access to schools, elementary doors will continue to be locked, and schools are going to really isolate points of entry and exit more so than ever. All schools, even our secondary schools, are asked to pick 2 to 4 entry exit points and really focus on those areas. So our access to our buildings will be highly controlled, and I know some folks have concerns around masking and how will we know who belongs in a school and doesn't, but we've seen even here working back in our offices, you still know who belongs and who doesn't. We have no trouble recognizing colleagues we've worked with for a long time with the masking. So I would say just to allay that fear, I know people fear that, but I don't think it will manifest itself once we come into September. School staff are always well aware of who's supposed to be in the building and who's not, and through our controlled access mechanisms and just our policies and enforcing them, schools will be very safe places this fall in terms of visitors and general safety routines. So thanks for that.
Thank you, Superintendent Podjaberic. And I know one of the many new signs that individuals are going to see as they enter the premises relate to us really limiting those who will be coming into our schools for obvious reasons. At this point, I'd like to turn it over to Director Miller for some final words.
I would like to thank everybody that asked questions, the thousands of listeners, and there were thousands of listeners who tuned in tonight to hear what we had to say and what we tried to address for you. We made two big announcements around the masking of grades 1 through 3, mandatory masking, and of course the delay of school to September 13th. We have done that, the delay of school, because of the fluid situation that we're in. We only learned this week and late last week how our schools need to be organized. We only received on August 24th the intent to return, and all school boards, I would say, are in the same situation. It's virtually impossible for us to have our schools up and running and organized, create 4 virtual schools, have all our PPE, which we have not yet received, different funding announcements that seem to be made almost on a daily basis. So the delay is to allow staff, parents, and students to make sure that when they do come back to school, we're ready to receive them and students are ready to learn. We will be sending out the details of that in a communication. But I thank parents for their patience, and I thank parents for their flexibility. I just want to comment on tonight's town hall. I fully appreciate that there are a great many anxious parents out there, and students and staff. This is unprecedented times, and I know that there have been many sleepless nights over the spring, summer, and now even, as parents worry and are concerned around their children's return to schools and what that means for them. But at the same time, you want your children to get the best possible education they can get. The education that the Halton District School Board has always provided. And you want to make sure that we are adhering to the principles of and tenets of human rights and ensuring that all students, those that are marginalized, those and are not subjected to racism and all those other things. We know that. We're working hard to try to make this the best possible experience for your kids to come back to our schools. I can assure you, we want what you want. We want students to be happy, successful, and feel safe and belong. And I know that that's what you want. We may disagree on some of the things that we've implemented. We have parameters, we have processes and protocols that we're required to follow. We have collective agreements that we must adhere to and should adhere to. Our staff is nervous, I'm nervous, you're nervous. There's nothing wrong with that. Absolutely nothing wrong with that. So I ask you to trust your judgment, trust your decision, and support your kids. I can promise you, we are going to do our absolute utmost to do the same, to support them, help them, and keep them safe. This is a very difficult time for everyone. And I would just like to say, we feel it for you, and we hope that this has drawn, even if it's a smidge, made you feel a little more confident about the decision you've made and how students will return to school. Thank you very much. I want to thank all you senior staff and the chair of the board and Dr. Meghani for their contributions tonight, for helping try to get the message out there. We still have more to come. There's still more communications, and we'll do our very best. So with that, I thank you all and wish you a good night and good night.